This is Dr. John Wycoff with another exciting podcast with Pathways to Wellness with yours truly, Dr. John Wycoff. Today's topic is how to avoid or treat injury, muscle spasm, and pain. And believe me, this is an area that conventional medicine just does not address very well whatsoever. Flexibility, strength, excuse me, and dealing with pain. Acute or chronic pain is something that we've lost track of in conventional medicine. So we're going to talk about those topics today and talk about the functional medicine approach, because that's what we do at Wycoff Wellness in East Lansing. We look at an integrative functional approach to any chronic problem. How can we avoid it? How can we treat it? How can we restore normal function in an integrative fashion? So when we talk about injury, number one thing is we want to avoid injury. As you get older, especially if you're on the other side of 50, this involves work. You have to work on flexibility, stretching, maintaining muscle mass, strength. How do you do those things? Well, you can go to the gym, but I find that people just who go to the gym don't know what to do. Oftentimes, hiring a trainer, at least for a short time, to teach you how to work on those things. Flexibility, strength training can be very invaluable. So spend a few dollars, it's not expensive, and get an expert to help you with flexibility and strength training. One of the most important things you can do as you get into your 50s or 60s is to exercise. Not just getting on the treadmill or riding a bicycle, but doing strength testing, resistance exercises, and flexibility. You can do things like yoga, very, very good for stretching and flexibility. And we're not talking about you need to become a gymnast, but you got to move, you got to stretch. If you stretch your ligaments, your muscles, your cartilage, they are less likely to be damaged. The less you use them, the more likely they are to damage. The cartilage dries out, the tendons shrivel, the muscles get tighter. When you have healthy muscles, ligaments, and cartilage, the normal everyday stresses are not likely to cause injury. But if you let them go, you're going to have an injury, or, God forbid, you have an unexpected fall or an accident, and then we have injury, muscle spasm, muscle injury, and pain. So let's talk about injury. So there's a number of injuries that we think about, like especially in your low back. You can have a herniated disc. That's a chronic weakening of the outer sheath of the disc, and the soft center part of that pushes out and can press on a spinal nerve. That's called sciatica, and it can cause severe pain. One of the worst pains you can have is sciatic pain or nerve pain. A disc doesn't herniate all of a sudden. It herniates because it's gotten weaker and dried out because you haven't done the exercises, stretching, and you've not eaten correctly, drank enough water, supplemented with enough omega-3 fatty acids or other nutrients to maintain the health of that disc. That disc will dry out with lack of use and with poor nutrition. So a high-protein diet, we've talked about that before in other podcasts, upwards of 1 gram per pound of protein per day, ideal body weight. So if your ideal body weight 200 pounds, that's 200 grams of protein a day. Believe me, that's a lot. I work on my protein intake every day. So a herniated disc oftentimes is problematic. Doesn't always need surgery, may need surgery. We'll talk about things you can do. A degenerated disc is can progress to a herniated disc. And as its name says, it's just a disc that's degenerated, so that the shock absorbing function between two vertebrae, what the disc provides, is gone. The disc becomes drier. The outer sheath of the disc those fibers can break down, much like if you were looking at the fibers of a tree trunk. The outer fibers get dry, and the inside of the disc, which is normally kind of a jelly-like consistency, keeps pressing out and can ultimately herniate. You can also just get weakness of ligaments and tendons in the back, hip, knees, shoulder, wrist, anywhere. This chronic weakness can lead to structural instability. Some people have more lax ligaments, and there are certain medical conditions beyond the scope of this talk. Ehlers-Danlos syndrome, other syndromes that have hypermobility associated with them. But if you think you have hypermobility, if you can, take your finger and push it way back, or you can twist your arm almost all the way around, or hyperextend your knee beyond a straight level, talk to your doctor about testing for hypermobility issues. Those can be very serious, need to be diagnosed, because those mobile tendons can also affect your heart muscle, cause some valve disease, and a myriad of other issues. So not to be taken without some degree of seriousness. As we get older, we oftentimes have had a number of minor injuries. You see this a lot in the in sports where people have an Achilles tendon that ruptures. And oftentimes they're just walking or running. They're not even hit like a football player or jumping. Well, what has happened is that tendon has been stretched out so many times, it has been micro-traumatized time and time again, just like a rubber band. If you keep pulling it back and forth, you say, well, I'm not doing anything abnormal to the rubber band. Eventually, though, it will rupture because there are micro tears that are occurring each time you pull on that rubber band. Same way with your tendons, especially tendons that have a lot of stress on them, like the Achilles in the back of your heel. Now, you can reduce that risk of injury, and you'll see athletes talking about this by maintaining a high-protein diet, adequate hydration, appropriate exercises, stretching, resistance exercises, supplements, things that we talk about at Wycoff Wellness. So the degree of repair and regeneration is greatly dependent upon biomechanical function. Proper bone alignment, joint movement, and the ability to get nutrients to the cell will provide effective therapy. The muscle cells can be strained or injured, and they oftentimes respond to rest. They may apply to heat, topical heat, or even ice in certain situations. But more than anything else, they need nutrients. We've seen people that's posture has gotten to be a problem. They're leaning more and more forward. They don't sit up straight. They lose some of that muscle control, muscle function. And when you have muscle injury, you get pain. You may get spasm, cramping, or just pain. And what do you do about that? Well, at Wycoff Wellness, we take a more holistic, integrative approach, try to determine what's causing the pain, why did the pain happen in the first place, and then look at treating not only the acute pain, but trying to prevent the pain from becoming chronic or ongoing pain. Prolonged or excessive pain and inflammation is a problem. You oftentimes see people that have injured a shoulder, and their shoulder becomes frozen because they don't move it anymore. It hurts to raise it, so they stop raising it. They may use it like this, but all of a sudden they can say, well, I can't lift my arm above here. Their shoulder's frozen. It's a very, very serious problem, one that we can help to a point, but may require you to have surgery done. So what do you do if you've got muscle pain, muscle injury, joint pain, joint injury? Number one is if the joint needs to be rested after an acute injury, let it rest. See your doctor, get the appropriate imaging studies done, whether it's an X-ray, MRI, find out what's wrong, how severe the injury is, what to do with it. Just don't push through the pain. Number two, be sure you're on an appropriate diet. You need a high protein diet. As we talked about, we need 1 gram of protein per pound of ideal body weight. As long as you don't have kidney or liver disease, that's what you should shoot for. That's a lot of protein. You should start your day with protein. Eggs are the best way to start your day. 3 or 4 egg omelet with some cheese, some meat, maybe some bacon or sausage. You'll get somewhere up to that 30 gram of protein mark. You'll feel better, you'll have more energy, your brain will work better, and you'll give your body the amino acids that it needs. Plant-based amino acids and protein are fine, but they're not nearly as bioavailable as animal-based protein. So make sure you're getting eggs, some meat, chicken, fish, pork, beef into your diet every day, especially if you're trying to nurse an injury. Foods that have a little extra fat is also fine. You want to get foods that have omega-3 fatty acids. Those are the fish oil type supplements. Foods like avocados, nuts, seeds, very, very important to not only use during an acute injury, but during a period of trying to build muscle. So some suggested steps to take care and help maintain your body's optimal function, making sure things are aligned correctly. Nourish your tissues. We talked about high protein diet. That'll help your cartilage, your ligaments, your tendons, your muscles. Take the right supplements. I'll talk a little bit more about injury supplements in a second. Exercise regularly to improve range of motion, improve strength, but flexibility is so important. Reduce stress, get adequate sleep. So let's talk about some nutrients. What are the key nutrients if you have pain or an injury? Probably number one is to try to get an adequate amount of vitamin D3. You can do D3 with K2, 5 to 10,000 IUs per day. Should be monitored through a blood level, and oftentimes will help you establish the ability to absorb enough calcium to expedite healing. That's what vitamin D does. It helps your body absorb calcium in the gut. Number two is calcium. I like the Cal Appetite form. We work with a company called Metagenics, and they have, I think, the best product available in the world. It's called Bone Builder. And Bone Builder is derived from the bones of calves in Australia or New Zealand, a specific strain or breed of calf. And they harvest the bones and they grind them down and they make Cal Appetite. It's a proprietary product, but 3 Cal Appetites per day give you the calcium you need especially if there's a bone injury, along with vitamin D. Omega-3 fish oil, again, very important. We work with Metagenics on a high-quality product called Omegagenics EPA DHA 723 per day. And just to note, you can get any of the products I talk about either in our office or online at wycoffwellness.com. Shop our store. We oftentimes have Metagenics promotions, 20, 25% off. Get on our mailing list. You'll get the promotions. You can stock up. But all the products that we have in our office, actually the entire Metagenics line, is available through our Wycoff Wellness online store at wycoffwellness.com. So beyond this, we have a product called SPM Active. SPM Active is derived from fish oil, but it's derived as a very refined part of the fish oil that you can take in addition to your omega-3 nutrient, but it really does reduce inflammation in the joints. So SPM Active is a great medication for acute pain, for chronic osteoarthritis, anything that has pain, especially autoimmune diseases. So SPM Active is something that you should take. And we also have some specific things for muscle pain, like magnesium glycinate. Magnesium glycinate, very, very good for muscle pain. And sometimes there are other supplements or nutrients that we can individualize for you, or we can get a micronutrient test from SpectraCell, a blood test, and we can measure those individual nutrients that you may need and try to devise a program to meet your functional needs. So, in wrap up, healthy, high-protein diet, 1 gram of protein per pound of ideal body weight. That's a lot of protein, 150 to 200 grams per day. That means you have to have protein all through the day, at least 2 meals a day that have protein, preferably animal-based protein, maybe a protein shake, maybe what I use are some venison beef sticks. You can get any other beef stick you like. Usually have about 10 grams of protein. Eat those as a snack, 2 or 3 of those a day. Great for causing you not to be hungry. Good for your muscles. Help you get through an injury. Take your vitamin D, your calapatite, your omega-3 fish oil, your SPM, your mag-glycinate. We have all those products available at Wycoff Wellness at 1226 Michigan Avenue in East Lansing. You can stop by during office hours, Monday through Friday, 8 to 5. We have an in-store store. You can purchase them right there. Or you can go online. You can do it right now. wycoffwellness.com, wycoffwellness.com. Click under the store tab or shop here tab or shop now tab. You'll go to our online store. You can browse the store. You can query muscle injury supplements or whatever topic you want. You can order different size bottles, and they're going to be shipped to you in 2 to 3 days. Oftentimes, there's no shipping on orders. So take advantage of the Wycoff Wellness online store, the educational information there, and take advantage of us, our office. We're here to serve you. If you don't want to see us or need to see us as a patient, you can stop in and buy any of our supplements. You can buy them online or in office without being a patient, without seeing me. My staff can help guide you, make the informed choices, help you understand the difference between a good supplement and a bad supplement. Really the most expensive supplement you can take is the one that doesn't help you get better. And so many people just take supplements because they think it's the right thing to do. It's not a very regulated industry, and oftentimes we just get very, very poor supplements. So keep listening. There are other podcasts that go to similar topics as we've talked about today regarding things like insulin resistance and weight control and GLP-1 drugs and why metagenic supplements are superior. Listen to those. They're all in our library, and they're all short, easy to listen to, and help you get on that pathway to wellness. This is Dr. John Wycoff. Thank you for listening.